everybody. This is Jeff Beale, the business guru, and today I've got an extremely, out of 300 podcasts, guys, this is one of my most interesting guests. She's a wonderful, wonderful woman, and you'll see why shortly, and you'll see why you should learn and listen from this very learned woman. She's got an unusual name, Eileen Bertrand, and she's the MD, and her company name is Mary Helene Enterprises. In industry, healthcare. Been doing this, guys, for, can't believe it, can you? 55 years. How can a woman who looks 55 be doing this for 55 years, you're going to ask me? Well, she's going to tell you shortly. Brief description. I take care of people in pain through corrective exercises, homemade orthophonics, and through the use of highly effective, all-natural, quick-acting pain-relieving cream. She's got a wonderful cream out, guys, and she's going to check it out. She's going to tell you all about it. You'll tell you the website, where to find it. I also teach pain relieving course. Key achievements, book published, low back pain, 3 steps to relief in 2 minutes. Personal motto, every cloud is a silver lining. Interesting fact, I graduated from McGill Medical School in 65 when I was 22 years old, the youngest in my class. And might I add, she's probably the smartest as well. My great pleasure to welcome to the stage, Eileen. How are you today, my friend?
Well, thank you very much for the great introduction, Jeff.
You're most welcome. Tell us about your journey. What has inspired you all those years ago to, at a young age of 22, to know what you wanted to do? How did it all start?
Well, I have to say that I started when I was much younger. I started reading when I was 5, and I loved to read. And my father used to send me up to my room when he punished me. And boy, that wasn't a punishment. I was having so much fun because I was reading.
With a torch.
And my dad was a brain surgeon, and when I was 10, he realized that he wasn't punishing me. He was he was sending me to my room so I could read. So he took away all my books and put them down in the basement, and all I had in my room were his medical books, his journals and his textbooks and so on. And so when he sent me to my room, I started reading his medical. When I was 17, I was in first year medical school. It was very easy for me because I'd read so much about medicine even before I started.
You understood the body, and you knew what made it work, and blood and this, that, and the other, right from the get-go, right? And you're probably, by nature, you was probably asking why.
In fact, even when I was in medical school, I was thinking up research projects.
What's been the most challenging aspect of your work, and how have you overcome that?
The most challenging aspect of my work is that when I was pregnant with my first child, I started getting low back pain. And I essentially had 37 years of low back pain. And the reason, and can you imagine going to work when your back is hurting, and you've got to examine your patients, and you've got to.
It's debilitating, isn't it? Some days, you probably don't feel like getting out of bed.
Well, sometimes I couldn't get out of bed.
Wow.
So anyway, and all the treatments were failing me. There was nothing that was working, and my back pain was called non-specific, which means
I got no idea.
And then I realized that my pain was not coming from my lumbar spine, which is easy to see with x-rays and CT scans and so on. It was coming from my pelvic bones. Think about it. Your pelvic bones are huge, and they're carrying the whole weight of your upper body. They're carrying your head, your shoulders, your arms, your fingers, everything. And that weight is pushing them away from the sacrum in the back where they attach. And because of that, those joints between the pelvic bones and the sacrum, they're called the sacroiliac joints. Those joints are the most stressed joints in your body.
For obvious reasons. They're carrying all that weight around.
Absolutely. And then not only that, but your hip joints are inside your pelvic bones. So every step you take jolts that joint. And so that joint is your body's shock absorber. And
That's
because
right.
it's a shock absorber, it's instead of being smooth like every other joint, it's full of bumps and hollows to absorb the shock of every step you take. And because of that, it's invisible to X-rays, scans, MRIs, ultrasounds. It's totally invisible. And because of that, the pain that comes from there is non-specific
Yeah,
because people no longer examine their patients. They
yeah.
don't put their fingers where it
They
hurts.
just listen and say, take a pill and come back next month.
Exactly. And so I put my fingers where it hurt, and there's two little bumps there that everybody can feel. If you put your hands in your back,
Yeah,
and you'll feel the two little bumps that are essentially where your pelvic bones, the top of your pelvic
correct.
bone, and if you feel those bumps and there's pain underneath those two bumps, or one of the two, then you know that bone is displaced. If the bump is higher, then you know the bone is tilted forward. And if the bump is lower, the bone is tilted backwards. And then the treatment is obvious.
Tell me, is this something a chiropractor would look at?
Ah, yes, and chiropractors know all about it, but they don't tell their patients
Because it's too easy. Right.
how to fix it very quickly and very easily.
Yeah,
And I like to tell my patients how to fix themselves. And so I give them this 2-minute exercise, and 90% of them get up from the exercise with zero pain because they've put their pelvic bones back where they belong.
yeah, your body talks to you guys. You should be listening. If you're 20 or 30 kilos overweight, and then you think about it, I used to tell my friends, imagine my friend, because he's overweight, big belly, right? I say, imagine my friend, what I want you to do tomorrow, do me a favor. I want you to grab a 12-kilo bowling ball, a typical bowling ball, and I want you to walk around with it all day and see how tired you feel. He goes, what do you mean? I said, well, that's what you're doing at the moment. You're walking
And
around with this pretty big bowling ball.
not just how tired they feel, but how their bones are being pushed aside by
Correct.
the weight that they're carrying or the fat that they're carrying.
You're around
It's
their
pushed
organs.
away from those joints
Yeah,
and displace the joints. And
yeah,
it's so easy to fix them.
yeah,
So, but you have to know how to fix them. And I think those who have low back pain should get a hold of the book I've written.
yeah.
And
Low
it,
back pain. Three steps to relief in 2 minutes. There it is, guys. There's a challenge for you. If you've had chronic pain or any pain, you know, it's a small investment, right? And then read the book and act on it, guys. In fact, you can even reach out to Alina, and have a chat to her. Find out about this guy. She's got some amazing products that can help you. And when I'm 77, guys, some of these products, they're life changing. You don't have to go through life in all this bloody pain. You don't think, oh, nothing I can do about it. There's always something you can do, right? Keep looking for a solution. Never, never give up. That's one of my strong mottos in life. Never, never give up. And use common sense, guys.
well, this is essentially this is the cream that I've created. I was injecting
Good job.
people
I
around,
love the packaging. Beautiful. Beautiful.
I was injecting people around nerves with this totally natural substance. It's called mannitol. Every plant and every mushroom has mannitol because it kills bacteria and it's an antioxidant. I was injecting people around nerves with that, nerves that went to painful areas. And even before the needle was out of the skin, the pain was gone. And this pharmacist was looking at me and she said, I've never seen pain go away so fast and so completely. But she said, people don't like injections. Why don't we make it into a cream? I said, sure, let's make it into a cream. Well, we had to try 16 different base creams before we found one that allowed the mannitol to penetrate through the skin and to reach the nerves. And so then I started investigating it and trying it on patients. everything, for everything, migraine headaches to painful neck to painful feet to arthritis in the fingers, whatever, and working amazingly well. In fact, the average pain relief was 53%. Okay, it's not 100%. By
Sure.
the way, but the thing is that the average pain relief for a narcotic is 36%.
There you
The
go.
average pain relief for Advil or Voltaren or
Yeah.
naproxen
Yeah.
is 23%. And
Yeah.
the average pain relief for acetaminophen, Tylenol, is 13%.
Yeah. No,
So,
not only that, you take too much of that stuff, guys. It's not good for your body, your kidneys, etc.
and this is totally safe, and
Yeah.
the pain relief is 53%.
Yeah.
So I think it's very good. But I'm giving a course. This course will be teaching you exactly how to use the cream to obtain the maximum relief. I'm not just teaching them how to use the cream. I'm teaching them how to make their own orthotics out of Kleenex and duct tape. I'm teaching them how to do all kinds of things that will relieve their pain. And of course, I'm teaching them how to get rid of low back pain in 2 minutes.
Your
So
opinion, what have been the key qualities or skills that have contributed to your amazing success?
I think outside the box. There's two kinds of doctors. There's the cooks and there's the chefs. And
I like that.
the cooks know their recipes and don't teach me anything else. I know.
Yeah.
Whereas the chefs say, I wonder how we could improve on this.
Yeah.
Because they're chefs, they have all these new ideas on how to use different things and try different things. And very often it makes a huge difference.
Change.
That's what I've done all my life. I've invented all kinds of things. I just love fixing people. It's so much fun. Doctors would send me their hopeless pain cases because that's all I did for the last
Yeah.
12 years of my practice is I would treat these hopeless pain cases, and 80% left my practice with no pain. Instead of using everything what everybody else does, I was thinking, I wonder what else we could do. It's like solving puzzles. And for me, that was a lot of fun. Okay, I'm no longer licensed to practice medicine. I gave up my license when I was 77 and a half
Uh-huh.
because that was long enough and it was COVID. And I thought if I catch this thing,
Enough.
it's
Yeah.
not going to be good. I meet people all the time who have pain.
Yes.
And
Absolutely. Many of them.
I invent new ways right then on the trail when I'm going on my 10,000-foot walk every day.
Your goals and aspirations for the future.
Well, I want the whole world to know how to relieve their own pain, do it themselves. I've actually prepared a free webinar, and if people want to have a copy of the webinar, all they have to do is sign up for it and they'll get it.
Lovely.
Right now, I've got a website, and you can go to the website just by going to nopain.ca. There's also the QR Cream website,
Yeah.
um, which which you will see right at the bottom. A
Yeah.
calling card.
Yeah.
When he saw the subject of the card, because I was advertising the cream and
Yeah.
I was advertising the book on the
Yeah.
calling card. When he saw that, he said, "Oh my God, I've had years of low back pain." I said, "Oh, let's have a look at your back." And sure enough, his pelvic bones were displaced. So he did the 2-minute exercise. He gets up from the exercise. He walks over to a chair, sits down, stands up, and he says, "This is the first time in 6 years that I've been able to do this with no pain at all." And so when I came to get the calling cards, he hands me the box. And I said, "Well, how much do I owe you?" He says, "Do you know how much money you've saved me and chiropractors and physiotherapists?"
Yes.
He said,
Oh,
"This doesn't to pay for all the money you've saved me. And so he
It's
gave me
what a great
health
story.